Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wieman.
And I'm Dr. Paul Zalzal.
Paul, in today's episode, we have a really good video. It's going to help people determine whether or not they have a torn meniscus. So it's the top 5 ways to know if you have a torn meniscus.
What's a meniscus?
Meniscus is a funny word that talks about a piece of soft tissue, a piece of cartilage that lives between your femur, your thigh bone, and your shin bone. There's one on the inside and one on the outside. It acts like a little shock absorber between them. In a key part of your knee and often gets damaged.
Okay, so a meniscal tear.
Meniscal tear.
Two meniscus is a menisci.
Menisci, yes.
Okay.
A little Latin there. Usually you throw a little bit of Latin in. I like that.
I like to go to the Latin. Never took Latin.
I did actually take Latin. It was actually hard. I think I got a very okay mark in university. Okay, so number 1 for me is pain.
Pain.
Pain in the knee, specifically along the joint line. So right in that area between the thigh bone and shin bone where it bends on the flat part, pain.
What's it more common, on the inside or the outside?
I'd say 10 to 1 inside.
Medial meniscus
Yes.
tear, pain at the joint line on the inside.
Yeah, and then sometimes it can be a little bit more to the back. I'd say typically more to the back than to the front, but often right along the middle. So number 1, pain.
Pain. Okay, I would say the number 2 thing that you'll notice if you have a meniscal tear is mechanical symptom.
So we talk about this in a lot of our videos. What do you mean by that?
I mean, some sort of clunking, catching, locking, giving way. With the meniscal tear, we often talk about a locked knee, which means your knee is locked and you can't extend it fully.
Yes.
Because the meniscal tear is flipped in upon itself and you just can't extend your knee.
So you can't get it all the way straight?
Yeah.
Okay.
Can't get it straight. That's a mechanical symptom. So mechanical symptoms, I think, are an indication that you may have a meniscal tear.
Okay. Number 3 for me would be pain with one of 2 motions, either planting and twisting activity or deep knee bending. So pain that's aggravated by those specific activities. Because what happens is your thigh bone is kind of digging in on that piece that's torn, either when you twist or when you bend.
Yeah, there is some studies out there that show that deep knee bend, if it hurts on the inside of your knee when you got to do a deep knee bend, that's a good indication that you may have a meniscal tear.
And often I'll say to patients, so does it hurt when you bend? They're like, oh, I can't bend my knee. I can't squat down like that. I can't play back catcher anymore.
Yeah, that's it. Back catching days are over.
Yes. Okay. Number 4.
Number 4 is, I would say, some history of trauma. Okay, you hurt yourself. You were playing soccer, you planted and twisted, and then you had sudden pain on the inside, or you're jogging and you stepped in a pothole. Some kind of trauma that tore your meniscus.
Right. So when you hurt your knee, do you only hurt the meniscus when you hurt your knee? Is that like the only thing that can happen?
Yep.
Okay.
No, you can hurt a lot of things. You
Okay.
can tear an ACL.
Yep.
You can sprain your MCL.
Yes.
You can dislocate your patella.
Okay.
Heck, you could even rupture your quadricep mechanism if you were so unlucky.
Or patella, quadricep mechanism, yes, so the patella tendon as well. So I would agree with you. So yes, so on the list is a history of trauma to the knee, could be a torn meniscus.
It's a sensitive sign, but not specific, because it could mean a number of things. But
right, and you could have more than one thing as well.
Why not?
So your number 4 is history of trauma.
History of trauma.
Okay, so my number 5 is a history of no trauma.
You can't do that, dude.
Yeah.
That erases my history of trauma if you say history of no trauma.
I'm just saying, so some people have pain in their knee and they have no trauma. When I hear that, I'm like, you know what, this person might have a torn meniscus.
Okay.
Why does that happen? People say to me that all the time. Why did I get this?
I guess, yeah, you're right.
What is the answer? Like, why did they get it?
You could have a degenerative tear of the meniscus, where it just, with time, got a little bit of wear and tear, and then there's a degenerative tear of the meniscus. Or, another reason is, you don't remember the trauma that did it.
Yes.
Okay?
Yeah.
Which takes me back to 4, my history
of trauma. It always comes out. And some people, they'll wake up in the morning, I'll be like, you could have rolled over weird in the middle of the night.
Yeah.
But I usually look at them with a smile on my face and say, it's middle age. Just welcome to middle age.
That's it. Middle age.
Okay, so that gives a nice summary. So our top 5 for ways that you know you might have a torn meniscus. Number 1 is pain.
Number 2 is mechanical type symptoms, catching, locking, giving way.
Number 3 is the painful test of planting and twisting or deep knee bending. If that aggravates it, you might have a torn meniscus.
And number 4 is you absolutely have to have a history of trauma.
And number 5 is that you absolutely have no trauma.
Agree to disagree.
Agree to disagree. So it's kind of like a top 3 plus a couple that.
Yeah, I guess. It's 1 step forward, 2 step back kind of thing.
That's right.
Right.
So we hope that this helps you determine whether or not you have a torn meniscus. Ultimately, if you're worried about this, what should you do?
Take 2 aspirins and call me in the morning.
Don't Please don't call me.
No, go get it checked out. Go get it checked out. The
Yes.
diagnosis is made with, ultimately, our test that we do is...
So I would usually say mine is mostly physical
Well,
exam, but
okay.
yes, it's confirmed by the MRI.
history, physical
Yes.
exam, and
which everyone comes in and
investigation.
says, do I need an MRI? And you're like, I think actually this time you might actually need an
Maybe.
MRI.
Not everyone needs an MRI, but in this case,
It's a good test.
you can. So, any questions?
Please leave a comment down below.
Leave a
Tell us
comment.
about your knee injuries. Tell us about your torn meniscus, because it is very, very common. We see a lot of people with this problem.
Tell us if you had trauma or no trauma.
Yes, we can take a poll and
There
see
you
how
go.
many people were atraumatic. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.